So I had the privilege and pleasure to present an update of Keynote 799. Keynote 799 was a phase 2 trial investigating concurrent pembrolizumab with chemoradiotherapy, followed by consolidation with pembrolizumab in patients with stage 3 unresectable non-small cell lung cancer. In the Keynote 799, patients with unresectable stage 3 non-small cell lung cancer received one cycle of chemoimmunotherapy, followed by simultaneous chemoimmunotherapy and radiotherapy, followed by consolidation treatment with pembrolizumab. In the Keynote 799, patients were assigned to two cohorts, cohort A with a histology of non-squamous and squamous cell non-small cell lung cancer, and cohort B with a histology of non-squamous non-small cell lung cancer. In cohort A, we had a backbone chemotherapy of carboplatin paclitaxel, and in cohort B, we had a backbone chemotherapy of cisplatin and pemetrexed. And the primary endpoints of the Keynote 799 were, on the one hand, safety, in particular, the rate of grade 3 or higher pulmonary toxicities. And the second co-primary endpoint was efficacy assessed by the response rate. Well, we presented the first results of Keynote 799 some years ago. Here at ELCC, we had the 5-year update of the trial with more mature results. And when we look on the primary endpoints, number one, safety, we created a boundary of 10% grade 3 or higher pulmonary toxicities. We only observed a rate of between 6.9 and 8%, so we were clearly below this threshold of pulmonary toxicity. The response rate was more than 70% in both cohorts. And now with a follow-up of 5 years, we have quite mature efficacy data. When we look on progression-free survival, we had a median progression-free survival between 29 and 45 months, with a 4-year progression-free survival rate of 39% to 42%. And we observed the median overall survival between 35.6 months and 57.7 months, with a 4-year overall survival rate between 40% and 57%. Well, in the Keynote 799 trial, we could show that simultaneous chemoimmunoradiotherapy is feasible in selected patients. And we also could show that this novel schedule generated a robust ongoing anti-tumor efficacy in patients with advanced stage 3 non-small cell lung cancer. So this is something which has now moved into a phase 3 trial, which is the KEELING 12 trial. This trial has completed recruitment, and we are waiting for the final readout of the results.